After months of debate, supporters of health care reform legislation in Washington hope this is the week it finally gets passed. Opponents of it hope this is the week it finally gets put down for good. National experts shared their thoughts on health care reform with the MacIver Institute.
Politically, it's going to be very close. I think this will come down to a handful of votes in the House of Representatives. As you know, as soon as the House approves this bill, we're done. It's off to the Rose Garden signing ceremony. They might argue that there'd be a second or a third bill for reconciliation to change things between the House and the Senate. But ultimately, it passes in the House and it's the law. And I think that's going to be decided not in the next 7 years or the next 7 months, but the next 7 days.
It's nip and tuck. Look, I refuse to bet against Reid, Pelosi, and Obama, who have proven that they will pay $100 million bribes to buy votes. They will make someone a judge to get the brothers' vote. We're up against that. Now, on our team is the legitimate anger, concern, and focus of the American people, and the careerism of a lot of Democratic congressmen and senators who would prefer not to be thrown out of office on their backsides. So, which their egos or the ability to buy their souls with our tax dollars? It's 50-50.
One of the core arguments we've heard come forward is this: we can't sustain health inflation, so we need this legislation. According to the government's own chief actuarial of Medicare, a government employee, a federal government employee, health costs would rise under this plan over the next decade. Even Paul Krugman, who's never seen federal legislation he didn't fundamentally like, and government expansion he didn't really like, has looked at this and said, well, it's still kind of a bargain in the overall scheme of things. When even Krugman doesn't buy the White House's argument, you've got a problem with the White House's argument. It's not going to bend the curve in any way, shape, or form, because instead of bringing costs closer to individuals, instead of increasing choice, instead of increasing personal responsibility, it does the opposite. It showers the system drowning in subsidies with even more subsidies. It expands Medicare and Medicaid at a time when we can't even afford our present obligations. It does nothing about tort reform. I mean, it doesn't address the core issues. You know, the most basic problem with American health care can be summarized in one number: 12. For every dollar we spend in the United States on health care, 12 cents comes from the individual's pocket. Until we have a system that addresses that, or a reform system that addresses that, it won't change. Imagine if you went to a grocery store and you only paid 12 cents on every grocery bill dollar. Would it be surprising that every year you'd want to spend more and more on food? Well, food's a basic need, so is healthcare. That's the core issue, and Obamacare does nothing about it.
I think this is the pivotal moment for healthcare. I think we need to move towards a free market healthcare system. We are perilously close to making one of the biggest mistakes in our country's history on health care. If Nancy Pelosi gets the votes that she wants on this health care bill, I think we will have to immediately move into a repeal, where we get candidates around the country to say, my top priority, the first vote I will take when I get to Congress, is to repeal Obamacare.
Congress could vote on the legislation late Friday or Saturday. For the MacIver Institute, I'm Bill Osmolsky.